Okay, I'm Dr. Peter Percuoco. Today we're going to talk about doing foam roller exercises for the muscles of the lower extremity. I'm sure you're one of my patients watching right now, and I've probably told you about some of the adhesions in your hips and pelvis and legs. I'm going to work on those. You want to do these every day if you can. It takes about 10 to 15 minutes to do it. Not very difficult, but it's meant to be painful. That means that some of the adhesions that are in the muscles, we're going to have to break them up by using the foam roller. So we don't want to go through this whole process and say, oh, that was nice. It's not meant to be nice. It's meant to beat up on the tissue, break up the adhesions, get some blood into those muscles, and help them to reestablish their normal function. We're going to start out first by working with the calf muscles. So we're going to work the calves, then we're going to move up to the meat of your thigh. And on the thigh, there's four sides. You got the posterior hamstrings, you got the medial adductors, you've got the lateral abductors, and you have the quads in the front. We're going to talk about all of them. First thing is we're going to work with the calf. So what we're going to do is take the foam roller and we're going to start by working from your ankle to the mid shaft of your leg. And you're going to turn it to the outside, turn it to the inside. There's one right there for me. So you can work that about 5 to 10 passes right over that real tender spot. Then you move and you add the exercise from the middle of your calf all the way to the knee, behind the knee. Same thing, back and forth. You'll have to support your body with your arms. Good 5 to 10 passes back and forth. The calf is done. Now if you want to add stress to the calf, because maybe down here you're having a little tightness in your calcaneal or your Achilles tendons, you simply just get yourself up off the floor and then put your other leg on top and then work that out as tough as you can, okay? Okay, so the calf is done, and now we're going to move on to the mid thigh. So we're going to start off behind the knee and work the hamstring. We're going to roll down the middle of the hamstring, back and forth, only to about midsection. Take your foot and externally rotate it a little bit. That'll be able to get the outside of the hamstring, bring it to the inside, get the inside of the hamstring. Now, that's only the distal knee to the mid shaft. Now let's go from the mid shaft all the way up into your hip and buttock. If you put your hand underneath your bum, you'll feel a bony little protuberance there. That little bone is where the hamstring's attached to. So as you're rolling down the foam roller, you're going to feel your butt bone hit the foam roller. That's the full extent of where you want to go. So mid-thigh now, all the way down to the bottom, or to your bottom, and grinding that. So you're going to go on the outside, and then you're going to turn to the inside, and get all of that tissue. Now normally people don't have a lot of hamstring issues unless they've just finished doing a heavy workout in the gym. Yesterday I did deadlifts. My hamstrings are lit up as a function of that. And I want to break up some of the adhesions and restore some of the blood flow and the lymphatic flow that help those muscles to heal. So for me right now, when I get to the outside right there on my outside hamstring, that's where I feel it the most. And it's okay for me just to sit on it right there. Just sit on it and grind it. Nice and easy. As I mentioned to you, everything hurts doing this. So don't think this is a fluff and buff workout. You really got to work at it. Okay, so that's the posterior aspect of the hamstring. Now we're going to turn to the lateral side on the outside of this leg. So what I'm going to do is turn over, and I want to get this muscle here. This is called your Iliotibial Band. This is the ilium, that's the tibia. It's a band of tissue between the two. So you're going to start by putting a leg over the top and hold your body up by giving yourself a brace with your forearm. Roll down. You're going to start by the knee first and come up to the mid shaft, rolling back and forth in both directions. This foot over here is supporting you so that you don't have to put so much weight on this thigh. Then as you come down, move your body down and work on one side, turn it over, work a little on the other side, and right down the middle. If you've been doing these as long as I have, you can use your whole body weight and really put a lot of stress on that. And because I can do it all in one motion, I am. Back and forth. Okay, these hurt like a son of a gun because the outside, the ITBs, the iliotibial bands, commonly build up a lot of junk in them. Okay, so make sure we work these. And if these get tight, they're going to put stress on your knee. That's going to cause knee pain and hip pain. And you're not going to know what the problem is. You might wind up under some different therapy when the reality is, if you take care of this on your own, you can beat this tissue up in its own game. Now, the TFL, or the ITB out here, connects up into your hip through what's called the ITB, the iliotibial band, and it's right to the outside of your hip. So we're not going to work the quad just yet. We're going to work this patch of tissue right in the front. To get it, we're only going to use the edge of the foam roller. So I'm going to put this band of tissue right here on the edge of that foam roller. Notice this leg is for support, so I don't crush myself in there, and it's just about a 6-inch movement right over the outside of that hip. So up in here, just a little bit of movement, rotate it a little bit to get the outside of that tissue, and then back over the front to get that tissue. So we did this, and now we did this pocket right here. And the hip bone right up here called the ilium, that's the furthest extent. So you're working basically this area right here. This too will hurt on most people because if the ITB is not healthy, neither is the TFL. All this becomes uncomfortable. Now we're going to go into the quadricep. In order to do the quad, again, we want to use, don't put 2 quads on at the same time and roll like this. You don't get much out of that. Use a single quad by putting it over the foam roller near the edge. And again, you're going to support yourself with your upper body. So you're going to come up and down. And I like to use full motions on these if I can. All the way up and all the way down. Now I might need to rotate in 10, 15 degrees in order to get the lateral aspect of my quadricep. Rotate another 15 degrees the other way to get a little more of the internal rotation or the internal aspect of the quadricep. But when you find it like right there, then you got to stop and work it. 4, 5, 6, 7 passes until you really grind that up out of there. Good, and then you're done. So now you've done the front part. Now you got to get the inside part, the adductor, A-D-D-U-C-T-O-R. The adductors bring your leg inside. Now, that band of tissue is all the way here, right into the pelvic bone, which is your ischium. So what you do is this, is you start out by getting the outside parts of the muscle. So you go out and back, and out and back. Now, if you leave your body flat on the floor, this doesn't do a whole lot, but maybe you're in a lot of pain, haven't done these before, so I'm all right with that. But if you're an athlete and you really want to get these things worked out, you might have to post up a little bit to put some weight on this, okay? Post up means get yourself off the floor. So right there is tender for me, right in that spot. But the place that's more tender is way inside, because all this muscle attaches to the bone deep inside your groin. And there's a tendon which they all connect to, the adductor tendon. So you got your adductor longus, adductor magnus, your adductor brevis, and your pectineus muscles. They all come together and they attach here. That area can become very, very tight. And when it does, it builds up adhesions, it becomes painful, and it restricts the motion of your hip. And now the hip's bugging me, the knee's bothering me, and you gotta break these up. So you take your leg and you roll across until you get this foam roller all the way inside towards your pelvis. Once it's in here, you gotta post up a little higher because you gotta get your weight on it. And you gotta find a point right there where it hurts like heck. And then just lightly grind over that tendon. This shouldn't feel good. I don't want you to go, oh, that's nice. If it feels nice, you're not getting it. Or it may not even be there, but in most athletes, it's definitely there. So grinding in tight, finding it the best you can. Now you could use also a small ball, like a medicine ball. They have them like half sizes, like they're a little smaller than a basketball. That works really good because it's round, it gets right up inside your groin, and you can roll all over that as well. But in case you don't have one of those, the foam roller, get that leg on it and grind deep inside there and work the heck out of that adductor group. All right, so you got the adductors all on the inside, you got the abductors on the outside, you got the quads on the front, the hamstrings on the back. Now it's time to get the glutes. The glute muscles are split into 2 sections. There's the glute maximus, which is, you know, the nice teardrop that everybody sees when you walk. Then there's the glute medius and minimus, which is really further up than that. It's kind of like on the back of your hip. When people say, oh, I hurt my hip, when they put their hand here, that's the gluteus medius and minimus, mostly the medius. But we need to break up the adhesions in here. When the sacroiliac joints and the lumbosacral joints are in some trouble and they don't have good stability, those glute medius and minimus muscles get really tight and they refer pain down the leg. Also thought of as sciatica, but in reality it's not sciatica, it's a referred pain from the butt muscles. So let's get to them. You're gonna sit up tall on top of the foam roller, and you're gonna take the foot and put it up over like a figure 4 and externally rotate. Then tip your body in 10 to 15 degrees and then start working on that tissue back and forth. The only way you're gonna keep the weight off of it is by using your arms. By the way, if you're not used to doing any of these, your arms are gonna be sore after a while because you're trying to hold the rest of your body up off the floor. So you roll down on one side and come up. And then decide how much weight you can leave onto your butt cheek by relaxing your arms. But the pressure is unbelievable. That pain in there is just awful. But you gotta break up the adhesions in your butt. And if you don't, you're gonna get sciatic pain and you're gonna get a lot of lower back pain. Same thing would happen if I did it the other way. Simply get up onto it, figure 4, turn left, and then grind it 10 to 15 degrees and work on that tissue, about 10 to 15 passes, okay? That's all I want to do for the lower extremity. I want to show you a couple of things which will help some of the posture muscles all the way up and down the spine. You're going to sit back like this, cross your arms in front, and you're going to keep your head in neutral position. You're going to roll back and forth over the lumbar muscles. You have to contract your core, meaning contract your abdomen. If you do it and it hurts really bad on your low back, I don't want you to hurt yourself, okay? You have to have some integrity to your spinal or to your central core. Without it, it may hurt more than help. So make sure you squeeze your abs real tight when you come back and forth over the low back muscle. And then when you cross your arms way over, it brings your shoulder blades out of the way. Don't drop your head back right now. Just keep it in neutral position and go up and down. You're likely to hear a bunch of popping and clicking in your spine as your rib heads and your vertebrae start moving. To make it a little bit more accentuated on either side, tip 4 or 5 degrees on one side and then grind those muscles all the way up and down. Same on the other side, just a teeny bit, just to get those muscles all the way through your mid-back. Okay, now when you're sitting here like this, you can also take your arms and now you can go back. Let your arms come up and let your body just extend over it. Only within your range of motion. Some people have a lot of range, some have a little. So there's 2 spots you can get. Come up a little bit down your back, a little bit more, and then you just try to open these up slightly. Come back up, roll it up closer to your shoulder blades, and then come back again. Okay, it gives a nice thoracic extension, opens us up nicely, gets us in some nice range of motion. Okay, so these are the foam roller exercises. These should be done every day, but if you can get 3 to 4 times a week, it'll really help to break up the adhesions in your system. If you want a good foam roller, call Isokinetics or find them online. Isokinetics.com. They're also sold through links in Amazon and so on and so forth. They cost about $25 to have it delivered to your home. Easiest way to get them is online. If you go to the store, they're going to cost you $40. So buy them online. Get working on these as soon as possible. And that's it for today. I'm Dr. Percuoco saying, get working.